Hello. Hope you guys are doing well. How you doing today, Mitchell?
I can't complain today. It's been a complicated week, but we have some good news today, and we have a really cool topic that we're going to talk about today.
Yeah, so today we're going to talk about what you should know about the Pfizer and BioNTech COVID vaccine, which is pretty interesting since that's coming up in the news nowadays. So let's get into it. So, credibility, I'm a PharmD candidate student, graduating in May. I do have experience reading research articles and some experience with vaccines, so just to get that out there, so I do have somewhat knowledge on the topic. Not too much yet, but getting there. So how does it work? So Mitchell, do you know what DNA and mRNA is?
Yes, I actually learned that in class.
So can you try to explain that before we get into how the vaccine actually works?
So mRNA carries the instructions to make the virus spike proteins. So it's what the virus uses to get inside the cell. The mRNA is given to the ribosomes, which can make the protein and the instructions that are destroyed. Antibodies, B cells, and T cells, you probably learned this in bio class or chemistry, are activated and the immune memory is made. So pretty much, it's a really cool guy that comes in and tells you that you gotta be ready for something that's gonna happen later on.
So is this going to change our DNA?
No. This is really annoying because a lot of people are thinking that this is going to change your DNA, but in reality, it's not.
Yeah, your DNA is like safe inside the nucleus, and this guy's like after that part, he goes to the ribosome and says, "Hey, make this protein." And then
Yes.
after a few days, that instruction is actually destroyed by your body. So like it's not in your body floating around for years. It's literally destroyed like a couple days later.
Yes.
So you don't have to worry about your DNA being changed. No microchips. We're just getting that out there now.
If you do want to find out more, just go into a simple biology class that tells you the formation of cells and how cells work, and you will really find out like a really cool way of how cells can recognize antigens, can recognize things from outside your body, and can save that memory for whenever you run into this thing from outside your body, and that way you can destroy it or fight it or capture it and learn from it. So, and we're talking about B cells, T cells, lymphocytes, monocytes, astrocytes. So this is really cool information that everyone should just know the basics, just so you don't hear in the news and they're like it's gonna change your DNA, or like it has a microchip. No.
It's very important knowledge to know. There's a lot of actual studies out there now that break it down to like a beginner level, so you can get into it. But the next slide is the study design. So it had about 38,000 participants in, about 16 years old. Well, yeah, 16 up and years old, randomized to a 1-to-1 ratio, meaning one person's getting a vaccine while another person gets the placebo. It had a 2-month follow up after the second dose. The demographics between the groups were very similar, so about half male, half female. So there was like some the ethnicities and races in there were actually like similar to what the U.S.'s averages are as well. Comorbidities are pretty much the same as well. They try to get equal group people in each group. And for people who care about it, it's a multi-center, multinational, randomized, placebo-controlled, observer-blind study. A lot of information there, meaning was done at multiple centers in the world, multiple nation, na- nations as well, multinational, and it's randomized, so people didn't know who was getting the placebo and who was getting the actual vaccine.
And this is very very important. So it was a randomized trial, and just to reiterate, comorbidity, it means just a disease or the condition that it's present at the same time with another or other patients or other patients, or it's the presence of two or more diseases, or conditions in one patient. So uh, just so that you know, an example is like diabetes, heart disease, blood pressure, blah blah blah.
Yeah. And so, does this thing work? Like, what's the point of doing a study if it doesn't work? So, the vaccine was effective in 95% of the patients with the confidence interval was 90.3 to 97.6. Mitchell can explain that later if he wants. The in people 16 to 55, it was 95.6% with a 95% confidence interval of 89.4 to 98.6. Now, when you're older participants, so 55 and up, well, older than 55, not 55, including a 55, it was 93.7% effective with 95% confidence interval of 80.6 to 98.8. So it's pretty effective. Just to give a reference
Yes.
point, the Zostavax vaccine for shingles was 50% effective at people age 50, and that got FDA approved. So it's a lot better than that. So
And we are, and from that time when that vaccine Zach's talking about, that was such a long time ago. Well, not that long, but it's, if you see the advancements of on mRNA vaccines, it has improved. So it's really cool. It's really cool technology that we're developing to fight this virus. So it is effective. And I know you hear in the news like it was 90% first, and now it's 95. Like, what's going on? It was just because we didn't have all the data at the time. We were just releasing it as we learned.
yeah. So adverse effects, they're on the slide, but for people who listen to this in a podcast later on, the injection site reactions were 84.1% in the participants getting the vaccine. These are all vaccine participants. I'm not including the placebo.
And injection site reactions are pretty much like a rash, or just a little swallowing, or just like a little redness.
Yeah. Fatigue, so you're feeling down pretty much, 62.9%. A headache's 55.1. Muscle pains, 38.3. Chills, 31.9. Joint pain, 23.6%. And lastly, the fever is 14.2. Is there anything else you want to add?
Some of the side effects, some of the or adverse effects,
Yeah.
they're not gonna happen to everybody. Some of them, they're not gonna happen at the same time. Some of them are gonna happen first. Some of them are gonna happen later. Some unlucky person might get all of this for a day or two, but it's similar to a Tdap. A Tdap vaccine is like it's many vaccines that many healthcare professionals must get. It's where you get like a sore arm, and muscle pains or chills, and a little bit of joint. So this adverse effects are similar to other vaccines that you've received before. So this is nothing that we haven't encountered yet.
These are pretty, like, mild side effects, adverse effects, but let's go into the severe ones now.
Okay.
So these are kind of interesting to me. So start with deaths, since that's kind of important. 2 deaths for people who had vaccine and 4 in a placebo, which that's might be due to other issues in their life, which is a very small number to call it from the vaccine.
Yeah, and we're talking about in this the trial, there was something 38,000, 36,000 people.
Yeah.
So we're talking about a 0.0034 zeros in a two, or 4 zeros in a 1%. So
It's very small, guys. It's very small.
yes.
So appendicitis, I can't say words today, is 8 in the vaccine, 4 in the placebo. Bell's palsy, which I thought was interesting, was 4 from the vaccine and 0 from the placebo. I'm a butcher this word, but I'm gonna try my best. Lymphadenopathy, which is basically a disease of your lymph nodes, swollen lymph nodes. It's
Yes.
64 in vaccine and 6 in the placebo. That was the interesting one too. That and the Bell's palsy, I was not really knew about, so I started reading about it. Anything you
A
want to
Bell's
add?
palsy, yeah, Bell's palsy and appendicitis. It's zero. It's 0.0002 percent of people that will get that got it out of 30 something thousand people. So it's very low. And Bell's palsy is, you can just Google it, but you also get it from ticks. It's the side effect of uh, getting Lyme disease from a bite of the tick. Um, and appendicitis, we don't have that much information. We'll um, as time comes.
Okay.
But this, appendicitis, just your appendix is just a little inflamed. So you're feel a little bit of abdominal pain. your large intestine is just a little bit inflamed. So that's pretty much it.
Okay. And so, some common questions I've been asked and from pharmacists and other people: does it work on everyone? Answer's no. Um, some people's immune system doesn't build a response to vaccines, so vaccines don't really work too well in them. Some vaccines do, but some don't. So
Yeah, it's not gonna work on everyone, and some people might not need it. But the problem is that we don't know what we don't know. So like we don't know if you're not gonna need it. So that is why everyone and we reiterate everyone should get this vaccine. Um, it's this is very important. You know, this is gonna save humanity from this virus. Now, Zach, do you need both shots? This is very important.
yeah, so both shots are very important. So the first shot kind of helps your body recognize the virus, and so you get that whenever you go get your shot, whenever they tell you can get it. And then for this one, you can get the second shot 3 weeks later. And the second shot just strengthens that immune response.
Now,
So
the second shot strengthens the immune response, but does that mean that I can travel? That I should travel or go out with the first shot and like not wear a mask?
no, you should always wear your mask, always social distance. This is not going to get rid of that mandates from your governors. Because first of all, the first shots in the study they say it's only 50% effective. So you need that second shot to reach that 90 some percent effectiveness.
Right,
So
and you're gonna get the shot because you're a nurse or you're a person older than 65 or whatever, but you don't know if the other person next to you got the shot. So we need herd immunity. We need to still wear our masks all the way until the end of next year, because by the end of next year, hopefully, 90% of the country of the United States will have the vaccine.
and hopefully it doesn't mutate anymore and messes
Let's yeah,
everything up.
let's keep our fingers crossed.
I'm very hopeful with this. So any
So
other questions?
how long does it take for immunity to fully developed?
So yeah, that's roughly 4 weeks. So since I said there's you get the first shot, then 3 weeks later you get the second shot. About a week after the second shot, you will have your full immunity. So it's really takes about a week. Everyone's saying.
Right. So remember that. So that doesn't mean that you should get the first shot and then go out and travel. That doesn't mean that you get the second shot this day and then you should go out and travel that same day. No. Like that means that you need to wait a little bit longer to be able to go out and travel or go out of do different stuff, but also wear that mask. If you're gonna do that, still, regardless, protect yourself. How long does the immune memory last? No one knows.
Yeah, no one
That's
knows this.
it's we don't know for sure. Will the vaccines be for free? Yes. Every U.S. citizen and resident will get the vaccine. Um, we don't know what implications will have to be for DACA, um, for kids that have come here and that only have don't really have a residency, or that for people that are illegally here in the United States. So the vaccine will be free for Americans, for U.S. citizens and residents. That's for sure. Does it stop the spread of the virus if exposed? We don't know yet. We need more information about that. We need to wait a few more months to know when the cases of people that received the vaccine that have been infected will come out. We need to study why they were infected again. Did they not wait the appropriate time? And things like that. But if you do have any other questions, put it on the comments below, and we'll be checking that out constantly. So we'll be trying to respond as many questions. We're gonna be posting this on the Instagram, so make sure that you follow us on Instagram uh, as
And
well.
share with your friends too, because I know there's a lot of misinformation out there about vaccines. Even from pharmacists I've met don't know some of this stuff. So please share it with people. And here's
Yeah,
our
sure.
references too, in case you guys want to look them up or anything. So I'll leave that on the screen for a minute. And just like, comment, subscribe, and we'll see you in the next video where we talk about the Moderna vaccine.
All
See
right.
ya.
Have a good one, everyone.